Assalamu alaikum. My name is Muhammad Ali Haider, and today I will deliver a lecture on pharmacology. This will be lecture number 29, and this lecture is basically based on drug metabolism, uh, diet, age, and interactions. Uh, Introduction. Today we will explore how diet, age, sex, and drug interaction affects drug metabolism, and why this matters for safe medication use. Diet and environmental factors. Charcoal, boiled foods, and crucifer vegetables induce CYP1A enzymes that goes to the faster drug breakdown. Grapefruit juice inhibits CYP3A enzymes. Drugs stay longer in the body and risk of toxicity. Cigarette smoking induces enzymes. Smoker metabolize some drugs faster. Industrial pesticides exposure worker metabolize drugs more rapidly. The key message here is to lifestyle and environment can change how effective or safe a drug is. So now let's go to the next slide. Age and sex difference. Um, Young and elderly patients more sensitive to drugs due to slower metabolism, and also there will be a sex difference. And the male rats metabolize drugs faster than the females, and that is basically linked to the hormones in humans. Difference seen with ethanol, propanol, and benzodiazepines, estrogens, and salicylates. Key message here that age and sex can change drug responses. Dosing must be individualized. Drug-drug interactions, enzymes induction, some drugs, for example, rifampicin, barbiturates, anticonvulsants increase metabolism of other drugs reduced, due to which the effects will be reduced. Examples is warfarin plus barbiturates. Will be less effective. Enzymes inhibition, other drugs, for example, cimetidine, ketoconazole, grapefruit juice, slower metabolism that goes to the drug level rise and toxicity risk may increase. Examples that grapefruit juice and certain hard drugs can cause dangerous arrhythmias. Tolerance, some drugs induce their own metabolism due to which their effectiveness reduces over time. Key message here is that combining drugs can be risky. Always check for drug-drug interactions. Clinical examples, like if we take the example of tafenadine plus CY3A inhibitor like ketoconazole, erythromycin, grapefruit juice, that causes the fatal arrhythmias and that will be gone to drug withdrawal. Allopurinol plus metacuprin goes to bone marrow toxicity unless dose is reduced. Cimetidine increases the effect of anticoagulants and sedatives. Key message: real world consequences show why drug interaction must be managed carefully. Conclusion: always diet, environment, age, sex, and drug interactions all influence drug metabolism. Emphasize importance is safe and effective drug use depends on understanding these factors. If you found this helpful, please subscribe for more pharmacology insights. Take care and please subscribe, like this video if you like, and forward it to your friends and colleagues. Take care. Bye.